What exactly is PCOD? What happens in PCOD?
PCOD is a very peculiar problem,
Okay.
and it is not about the situation right now. PCO has an impact from the mother's womb and their mother's womb. So, whenever we talk about problems like PCO, they have a very strong influence of the pregnant mother if the pregnant mother is overeating or taking a lot of rest or not burning calories as such, or she's having diabetes during pregnancy and there's a female child inside the mother's womb, the chances of that child having early PCOD is definitely there.
Okay.
So, when you go back and just check whether the mothers were overeating or taken bed rest or not checked for diabetes or obese, you can have a genetic influence that can create PCO in the child.
Okay.
And once you deliver, if you have not been given breast milk, you've been given formula, if you've given overfeeding was there, lot of overfeeding, chubby babies, which every Indian family dreams of, which is absolutely not good. You have chubbier babies, you have formula fed babies, overfed babies, constantly pushing food, eat, in spite of having no activity. When the child has an activity, there's a hunger that comes along with the activity. If there's no activity, just sitting and watching television or doing some chores there itself, their hunger pangs are not there. In spite of no hunger, if you overfeed the baby, that will lead to childhood obesity, and childhood obesity will lead to PCO.
Okay.
So there is inside the mother influence, intrauterine environment, which is epigenetics, around the time of pregnancy, and chronic malnutrition of the mother, whether it is under or over, whatever it is, and post delivery environmental influences that influence the baby.
For the child.
Yes, the formula feeding, the overfeeding, early weaning, giving multiple foods in whatsoever manner, giving a restricted environment, not open environment to play around, and schooling that is very academic oriented and not oriented towards holistic development, constantly sitting for hours together, all these things, and refined carbs, lot of outside food, not home cooked food, junk eating, all these things have an influence on the ovaries. And the ovaries start producing a lot of androgens.
Okay.
There is a lot of insulin resistance, which does not burn whatever you eat, and your sugar is going around in the body. The insulin is the one responsible to burn the sugar. Insulin is not working because of resistance. The sugar running around in your system is converted to fat by the liver. You have obesity. Your androgens give you a lot of acne, hair, all body hair which is coarse, and also eggs do not form and release.
Okay.
So there are no menstrual cycles on a regular basis. So this is PCO. Anovulation, that means no egg formation release, that means infertility issues and pregnancy issues. Second thing, your insulin resistance causing a lot of obesity, your androgens causing a lot of acne and excessive hair.
Okay.
One or the other factor is definitely there in PCO. And now PCO is again increasing day by day. Say 20 years back, probably I used to see one PCO woman in 1 week.
Okay.
Okay. Now I see 30 PCO women in a day.
Oh my God, really?
Yes.
And what age?
Then
range?
also I used to see 100 people in a day. Now also I see 100 people in a day. The number is fixed.
Okay. And
So-
what age range are these women usually?
Every age.
Okay.
From say around 10-year-old girl with periods that have started at 8 years of age, 9 years of age, a bulkier midsection, a heavier torso, and diabetic. Imagine I am seeing children at about 10-12 years who are 60 to 90 kg and HbA1c 7-8. That is PCO. Your sugars are just not balanced, your weight is not at all under control, and your periods are haywire.
So now for somebody who's trying to conceive, ma'am, and if they have PCO, what should they do first?
First and foremost is they should buy discipline, because the most difficult aspect of any human life right now in this spoiled environment is discipline. Discipline is something that is really required, because you have to do the same thing every day for the rest of your life.
Okay.
PCO is not 100% treatable, it is 100% controllable.
Okay.
So you should understand one point, that 5 months, 3 months, 10 months or 1 year of treatment does not control PCO. PCO is lifelong discipline.
Okay.
Discipline that comes with regular eating pattern, right eating pattern, right way to exercise, burn calories, right time to sleep, right time to make sure that your medication is taken, because there is insulin resistance. How much ever you exercise, if you don't give insulin sensitizers, it won't start as a pickup.
Okay.
So you have to give medications, you have to supplement vitamin D, you have to supplement insulin sensitizers, you have to give them antioxidants to improve the function of ovaries. So these are some medications that are very important. And you give medications and you don't exercise, doesn't work. You give medication, you exercise and don't eat properly, doesn't work. If you give exercise, medication, and you also take care of their diet and everything, and you don't sleep well and you're stressed out, doesn't work. So it's the 5 pillars that work out for PCO, and all of them simultaneously should be going together. Any one parameter that is lagging behind, you will not have the result in front of you. You'll always be cribbing that I'm doing everything but yet my PCO is not coming down. That doesn't happen at all.
So if you do all of this, it will come down.
Together, your PCO will sort itself in few months.
Okay.
PCO correction doesn't happen in 1, 2, 3 months.